Connected by purpose, driven by passion. This is Children's Healthcare Canada's Spark Live webinar series.
Children's Healthcare Canada would like to thank the following Keystone funding partners for their ongoing contributions that support all of our programs and activities. The Stollery Children's Hospital Foundation, BC Children's Hospital Foundation, the Children's Hospital at London Health Sciences Centre, the Alberta Children's Hospital Foundation, the Children's Hospital of Eastern Ontario, and Holland Bloorview Kids Rehabilitation Hospital. We would also like to thank the organizations that provide funding for our knowledge translation activities, which includes this Spark Live webinar series, the Spark Conversations blog, and the Knowledge Exchange Network. To learn more about Children's Healthcare Canada, you can go to our website, follow us on Twitter or Facebook, or you can sign up for our weekly Spark newsletter at childrenshealthcarecanada.ca/email, where you will learn about upcoming events, read the latest posts from our blog, and other exciting news and events from across the child and youth healthcare community.
Hello everyone, and welcome to this special edition of Children's Healthcare Canada's Spark Live webinar series. I'm Paula Robeson, your host for the next hour. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. And our goal is to spark conversation, ideas, and action. Since we are live, I want to remind everyone that while we don't take questions over the line, you'll all have the opportunity to type your questions in the question box at any time. We'll check the questions throughout the session and provide them to the speakers who will answer your questions at the end. Go ahead and put your questions in the box as you think of them. Don't wait until the end. We're delighted to be joined today by colleagues from the Ontario Centre of Excellence for Child and Youth Mental Health and Infant Mental Health Promotion for Beyond Building Blocks, investing in the lifelong mental health of Ontario's 3 to 6-year-olds. This webinar focuses on a partnership between the Centre of Excellence, Infant Mental Health Promotion, and School Mental Health Ontario to advance the lifelong mental health of Ontario's children and youth by starting in the early years. It's my pleasure to introduce the speakers for today's webinar. Dr. Purnima Sundar is Executive Director of the Ontario Centre of Excellence for Child and Youth Mental Health, and Chaya Kulkarni is the Director of Infant Mental Health Promotion at the Hospital for Sick Children, and she's also a member of the Strategic Advisory Committee for the Ontario Centre of Excellence on Child and Youth Mental Health. It's my pleasure to pass the mic to Purnima.
Good morning, everyone, and thanks so much, Paula, for the very warm welcome. I am actually going to pass the mic quickly over to my colleague, Chaya Kulkarni, and then after Chaya shares a bit more about infant mental health promotion, then I'll take the mic back and talk a little bit about the background to the work that we are embarking upon together.
Great, thank you, Purnima. So Infant Mental Health Promotion is a program of the Hospital for Sick Children, and we're situated within the hospital's Learning Institute. Our vision and our focus is on children from pregnancy up to the age of 6 and their mental health. And we strive to improve outcomes across their lifespan by translating and promoting the science that supports early mental health and translating that into practice for use by practitioners with families during pregnancy, infancy, and early childhood. Our vision is that for every child, they start life with the healthiest mind possible from the very beginning. And our values include sharing knowledge to build capacity and promote scientific inquiry, leadership through advocacy, resource development, and informing promising practices, understanding that is guided by science and experience and the wisdom of others, equity, diversity, and inclusivity as cornerstones for building upon community strengths, and relationships and collaboration as the foundation for all that we do. So I'm going to pass the mic back over to Purnima.
Thanks very much, Chaya. Again, thanks very much for hosting us today. For those of you who are less familiar with our work at the Ontario Centre of Excellence for Child and Youth Mental Health, we are a department of CHIO, but we are provincially funded by the Ministry of Health to provide supports to Ontario's community-based child and youth mental health sector to ensure evidence-based service delivery. So this looks, there are a bunch of different forms that this takes, and so we'll talk about one particular forum, which is our knowledge mobilization work throughout this webinar. But again, would encourage you at the end of the webinar to perhaps have a look at our website, and I believe that that's on our last slide, to learn more about what we do to support Ontario's child and youth mental health sector. So again, just at a very high level, our mission is to drive high quality mental health service delivery for all of Ontario's children, youth, and families. We do that by mobilizing knowledge and setting the bar for excellence. And our vision really is aligned with our mother organization, which is CHEO, Children's Hospital of Eastern Ontario. And for us, the best mental health and well-being for every child, youth, and family is really our goal. In terms of our values that guide our work, I would say that there's really nice synergy and overlap with what Chaya shared are the values of infant mental health promotion. And so I'll let folks just have a look at those and see that there really is alignment between our two organizations. Just at a very high level in terms of the work that we do at the center, again, I talked about knowledge mobilization and setting the bar for excellence through quality improvement. So making sure that organizations are gathering information and using that information to ensure high quality service delivery for Ontario's children, youth, and families. Our work really does focus on all of the developmental stages of the range of child and youth we want to be very clear that there are very particular and unique strengths and needs in each of the different age ranges, and to focus on them very broadly across from birth to 25 is difficult to do, obviously. So what we've done is really establish a deliberate focus on work in the early years, work in middle years, so age 7 to 11, work in the teen years from 12 to 18, and the transition aged years, so 19 to 25. So anybody that's a parent or who's ever worked with kids or has sort of observed children knows that a 2-year-old is very, very different from a 22-year-old. And so different types of strategies and solutions are required to ensure that we're meeting their needs in the best way possible. When we developed our strategic plan in 2019, we asked a number of partner agencies, we asked the sector, and we asked a number of advisors through our experience to identify what they see as the 3 to 5 big problems in Ontario's child and youth mental health sector, and not just to identify the problems, but to suggest that given where our center is and sort of has evolved, where is the center best positioned to move the needle on moving towards solutions in those particular areas. So we'll be talking today a little bit about some of our care pathways work. But other areas of focus, I won't go into detail now, but a few of our other areas of focus are around youth and family engagement. So we've been doing a lot of work in those two areas over the last 10 years, and most recently have developed a standard for youth engagement and family engagement at a system level. Another area that we've been focusing on is digital and e-mental health, and this was an area where we're just dipping our toe into pre-COVID, and now given that Ontario's mental health agencies are continuing to deliver service, albeit through virtual means, we've really had to accelerate our efforts in these areas. And so we've been providing a lot of capacity building and knowledge supports to the sector around how to do virtual care well, and how to evaluate it, how to make sure that we're continuing to provide really good service. We're also developing standards for e-mental health care in a couple of different areas. We're just in the scoping phase of that, so more to come over time. And another area that we work in is around system level initiatives, so making sure that we support agencies at the level of lead agencies. So the province of Ontario has 33 service areas with 31 lead agencies, and we work to support work on provincial priorities together. So it's that work that really did lead us to the work that we are doing today. But just in terms of the entry point, around one of our key knowledge mobilization activities is around policy papers. So we've developed 19 policy papers since 2008, and these are developed in collaboration with experts in key areas related to child and youth mental health, and they're aimed at both policymakers at the government level as well as organizational decision makers. And each of our processes, each of our policy papers starts with deep engagement with both clinicians and research experts, but but also with young people and families as well. And this is relevant, and Chaya will talk a little bit more about this through the development of our policy paper on early years mental health, but you'll see that this is a thread that weaves its way through all of our work related to the care pathways work that Chaya will speak about later on. One of the key areas that we knew needed some policy making was around infant and early mental health. This is sometimes referred to as social emotional development, but it really is the building capacity in children from birth all the way through 5 years of age to create form close and secure relationships between themselves and the adults that are caring for them, as well as with peers. We also want to support infants and children early on to develop the full range of emotions, so experience and manage those emotions, and also to encourage them to explore the environment that they live in. So this is within the context of their family and community and culture. So infant and early mental health was definitely something that was on our radar, but became really, really focused when we heard from our stakeholders that as children's mental health agencies, they were receiving a lot of referrals, a huge increase in referrals actually from schools and early learning centers about, challenges that 3 to 6 year olds were having in kindergarten classrooms, challenges with self-regulation, behavior, potentially mental health concerns, and so on. And these concerns were surfacing across a number of these sectors. And the reason why this is important is because we are not by any means suggesting that schools and early full-day kindergarten are actually causing these issues. The reality, though, is that they're being seen in school contexts. And to be fair, educators are trained to educate and service providers are trained to provide mental health service. And the two groups were not speaking as seamlessly as we thought they could at a system level. And so, again, what we do know is that if we can support children early on, we can help their success both in school and in life to follow. We also know that teachers, social workers, OTs, early learning practitioners, these are all folks that are working very hard in partnership with families to address these concerns as they're expressing themselves in a child's classroom. But we were finding that while they were talking with families, they weren't really talking with one another. And so thought that this would be a great opportunity for us to really look at the literature around how best to support those interfaces between all of the people that are connecting with a child and their family and with one another as well. So we embarked on the creation of a policy paper looking at investing in the lifelong mental health of Ontario's 3 to 6 year olds. And although we're focusing on 3 to 6 year olds, I think you'll find as well as Chaya starts her portion, it's not like at 3 to 6 years old, you find magically that issues start to appear. It's really the foundational things that children are experiencing that are leading to issues that we're seeing in the 3 to 6 year old age range. So the goal of our policy paper, clearly, infant mental health promotion are the experts in early mental health. And so wanted to make sure that they were leading us through this process, but also wanted to make sure that schools were engaged. So we partnered with our colleagues at School Mental Health Ontario to look at current evidence on mental health in the early years to really understand what optimal social emotional development looks like, to identify what some of those key risk and protective factors might be. So not just the things that are placing kids in vulnerable situations, but some of the things that can contribute to their resilience. We wanted to look at the Ontario context in particular, because that is the scope of both for us at School Mental Health Ontario and our center. Our focus really is on the province. And we wanted to see about different evidence-informed practices that might be able to inform our work as we move ahead to meet some of the needs of these little guys. So at a very basic level, the project objectives really were to look at what the needs are of Ontario's 3 to 6 year olds, and then to provide evidence-informed recommendations to guide a collective response. So not just in one sector, but all sectors working together to ensure healthy social emotional development. These are the key questions that we focused on. So we really wanted to get a sense of why mental health in the early years is so critical, and also look at what optimal mental health and development does look like. We wanted to look at some of the key contextual factors that influence early mental health. We also wanted to look at what the current best practices are in mental health promotion and early identification of social emotional vulnerability. We are not the first jurisdiction to implement full day kindergarten, and we're not the first jurisdiction to start to observe issues issues in school settings when they start to surface around social emotional learning. And so wanted to learn from others, both nationally and internationally, who have been doing work in this area, and then advance a set of best practices for responding to some of the challenges that are surfacing in this age range. I won't go into too much detail. I will encourage folks to take a look at our policy paper if you do have time. It is on our website, but it was a fairly comprehensive process that we undertook. We did a lit review. We did several key informant interviews with experts in the area or people who have deep expertise in managing some of these issues from a direct service perspective. And we did surveys, and you can see by the response rates that we actually did have quite a healthy end to work with. What I would say here is something to highlight is that it was a very broad swath of input that we received from folks. We wanted to make sure it was a comprehensive picture of what children are experiencing, and wanted to make sure that anybody that has occasion to interact with a child and observe these kinds of issues surfacing, that they had a chance to weigh in. So we were fairly thorough in our search strategy for information. And what we did find was that, first of all, there is a real commitment to addressing and strengthening infant mental health across perspectives and in all areas of service. And what we really want to convey here is that everybody has the best of intentions when it comes to supporting these little guys. It's just that what they're lacking is potentially maybe the information and the tools to respond appropriately. And the other thing we just wanted to reinforce is that the building blocks for strong mental health really are established in the early years and can provide a strong foundation for good educational attainment, financial stability, and broad health and wellness later on. So, there was a real acknowledgement of this as a really important area of focus across all of the people that we spoke to. We also learned that in Ontario, less than 50% of care providers really do feel like the children that they interact with are prepared to participate in their programs, and that a quarter of kids are entering kindergarten with vulnerabilities in at least one developmental domain. So certainly there's an opportunity for both identification and response in this age range. We also learned that children and families don't always receive the right support, and they don't receive it at the right time. Often it's not a comprehensive approach to support, and often it comes too late. And really at a foundational level, families and care providers need the right information, and they need to understand how to recognize issues as soon as they arise and respond appropriately. And again, everybody has a role to play. So like I said earlier, teachers are trained to teach, and educators are trained to provide our children with education, not necessarily mental health supports. And so understanding from a teacher's perspective or an early learning a care practitioner's perspective, if I see something, this is what it's going to look like, and then this is what I need to do with that, and this is where I need to how I can best support the family. So I won't go through all of the recommendations. There are several. So again, I'd reference our paper and would encourage you to have a look. And there is also an executive summary, so if you don't have time to read through the entire thing, it's right there on the first few pages. But we did want to pull on a few specific recommendations. So one is around, really supporting early identification and screening in order to determine necessary supports. And the second is around developing some pathways that are clear and efficient, that provide everybody that has occasion to interact with the child with a clear sense of, if this is an issue, if I see this as an issue, this is what I do next, and this is where I transfer, or these are the people that I need to be connecting with in order to provide care to this child and family in a timely kind of way. Again, want to make sure that all children and families have access to that high quality mental health service delivery, and to promote evidence-based training and resources on early mental health for families, educators, and also service providers. So the key people who are tasked with providing those supports to these very young children, they need the right information, and they need to feel equipped to act on that information. So now I'll turn it over to Chaya, who'll talk about how we took those recommendations and are currently advancing them.
Thank you, Pranima, very much. So out of that initial paper, it was clear that one of the challenges people were having was just finding the right pathway for children under the age of 6. So the purpose for us was to be able to collaborate with communities across Ontario to try and create those pathways so that there was a more coordinated approach, and develop resources that are characterized by high quality, evidence-based information that service providers can use across sectors. Because one of the challenges, of course, with infant and early mental health is that we have no designated experts in this field, and it really is a cross-disciplinary area of practice. So, in fact, nurses, physicians, social workers, early learning and care practitioners, they all need to be knowledgeable about this area. So, in terms of the project objectives, hold on one sec. We wanted to, first of all, develop a process that would be implementable within the communities, and then be able to evaluate, how well that was actually working. And today, as we've worked through this process, we actually call this an aspirational pathway that we will be creating with each of the communities that we are working with. So, for some reason my slides are not advancing. Okay, there we go. So this gives you a sense. I won't walk you through each. I won't walk you through this entire slide, but it gives you a view of the complexity of this work. So we're working in 3 communities across the province where we have engaged individuals from various sectors: education, health, children's mental health, early learning and care, child protection, even housing. So many different sectors are sitting at the table. We are certainly right now in between sort of, we've done Site 2 visits, and we're now looking at the care pathways that currently exist in communities and identifying the qualities of what will define their aspirational pathway. So it is a very involved process that we go through. We ask communities to look at their assets in terms of competencies around infant and early mental health and where the expertise exists. So in terms of the current state,
Maya, may I
yes,
interrupt for a moment to,
sure.
There's some scratching in the background noise, and we've had a couple of comments from our participants.
I'm going to take out my mic then.
Okay.
And let's see if it goes away, because I don't know if that's... Is that any better? Hello?
That's much better, Chaya.
Oh, is it? Oh, okay. I'm not sure what was going on. Okay, so my apology for that. So the first thing for us was to identify communities who already have infant and early mental health identified as a priority for them, because we didn't want to have to go in and convince people about this. And the second step was to bring sectors together so that we could begin this conversation about how to support mental health for birth to 6-year-old children. So this gives you some sense of the various practitioners, agencies that were represented in these conversations. In some communities, in 2 out of the 3 communities, the table is very big, with upwards of between 40 to 50, 55 practitioners there. And in the 3rd community, we probably have about 30 individuals. So phase 2 was project launch and information gathering. So in this phase, we worked to try to understand what is currently happening in the community. So everything from who raises the concern, where do they take it, what is each community doing in terms of promoting early mental health, preventing, vulnerability from becoming something more serious if there is a vulnerability for poor mental health in the early years. And then, of course, looking at what early intervention is happening and what treatment is happening. And during this phase, we also spent quite a bit of time looking at current sources of knowledge and expertise in terms of infant and mental health within the community. And we had, IMP has developed a competency framework that guided this process. So there was quite a drill down in terms of what we consider to be foundational knowledge and what knowledge and skills then defined promotion, prevention, early intervention, and treatment. And we asked practitioners to really think about new graduates and how ready they were to practice infant and early mental health or embed it within their scope of practice. During this phase, we also tried to better capture and understand the kinds of experiences families were having in terms of accessing services. And one of the things that we learned, I think, universally across all three sectors is families were being expected to do a lot of work when they were trying to access services. So then identifying opportunities to strengthen or add initiatives that were already in place, being able to fill the knowledge gap of practitioners, because that was definitely an area where there was a lot of opportunity to strengthen their knowledge and their skills, and then create a shared vision for a pathway. And this is where we tried to extract, what are the features of the pathway that you're aspiring to? So one of the common features that came out was being able to have sort of a one call or a process that no matter whose door you went through with a concern as a parent, it would follow a similar path. So what we found, what we've learned to date is the current system of supports for families is fractured, and we saw this even in the building blocks paper, and it really does. There's a need for much more communication and transparency between agencies, with families, etc. Practitioners working with infants and families, for them, quite. Oops, sorry, I've got to. Let me go back. Sorry. There were challenges around the knowledge that they had around infant and early mental health. In some cases, we heard stories of families having shared a concern with a particular practitioner and that being dismissed, and then a year or two later discovering that that was actually an early indication of something that was more serious. And then screening initiatives and protocols in terms of tools for developmental screening and observation are not consistently available or used. So in some communities, there's many different tools being used. In other communities, it might be one tool that's primarily used, but not by everybody. Agencies are often unaware of existing programs. So there was a lot of, oh, I didn't know that was even an option. We heard quite a bit of that. And one of the big issues we heard about was that the existing protocols don't actually have a follow-up mechanism. So an agency might refer a family to a service, but nobody's actually following up to make sure the family actually was able to access that service, or did they have difficulty finding the service. The other thing are wait lists, and I won't say a whole lot about this except to say and to emphasize, wait lists for this age group further derail their development. It really makes no sense to put a child under 6 on any kind of a wait list without giving families something to do. And people in these three communities all felt the same way. I don't think any of us like that this is what happens, but there's really a growing concern about this. And then there's very little existing data on early mental health. We actually don't know a lot about how our littlest children are faring in terms of their mental health or social emotional development, even though we do know from the science that this period of development has a profound impact on later mental health outcomes. And then each child and family is different, and in general, family engagement was a concern, and communities, there was a resounding consensus around wanting to do more, wanting to do better in terms of engagement of families. And we're now in phase 3, and of course, COVID-19 did change things a little bit for us. We are in the process of analyzing the data that we collected in each community. So this included data on training, on knowledge, on skills, as well as on current states. And we have those for each sector within each community. So we have a map for, say, early learning and care, and a different one for child welfare, and a different one for public health, et cetera. And then we are starting to put together the features that will define a community-wide cross-sectoral pathway for children from birth to age 6. So I will stop there, and I guess open it up to questions.
Thank you so much, Chaya and Purnima. That was very helpful. Just a reminder to everyone, if you have questions for our two speakers, please don't hesitate to put them in the question box. And here's one for others to join. What advice do you have to other? This was focused on Ontario. So what advice do you have for transferring this kind of program and partnership and initiative to other jurisdictions? Anything in particular, or are supports that are available?
So I can start and then maybe flip it over to the real expert in this area, Chaya. For me, Ontario, I mean, we all like to think of ourselves as unique, of course, and so I think Ontario is a unique context. What I will say is that, going back to something I said earlier about full-day kindergarten, it's not just that, it's not the fact that kids are in full-day kindergarten that is causing or creating these issues. The reality is that children are experiencing these issues. They're just being managed and supported differently in different sectors. And the identification is a bit new in the education sector because they haven't had little guys like this, sort of present with these kinds of issues to educators in the past. And so because of the new context, it's giving rise to this new observation in this sector. But I will say, and Chaya, you can certainly, elaborate or correct me if I'm incorrect. I will say that these signs and signals are there. It's just a matter of us understanding, first of all, what we're looking at. Second of all, figuring out how to confirm that there is an issue and what that is. And then third, supporting the child appropriately with all of the key players that need to be engaged. So I'll stop there and ask Chaya to weigh in.
Yeah, I mean, I think in terms of trying to share what we're learning and sort of the outcomes, to some degree, I think that's incumbent upon the center and our office to be able to share this information with people across the country, make sure that the reports and the findings are accessible. We're accessible. Infant and early mental health is really, in Canada, a relatively new scope of practice. It isn't in other jurisdictions, and in other jurisdictions, they actually have accreditation frameworks for competencies. And in Canada, we can't go that route because we don't actually have the infrastructure to even train people systematically in this area. So, I think one of the first things that has to happen is being able to provide increased access to information on infant and early mental health across the country. I think the center and our office, we do that in a variety of different ways. And I think, there's information on both websites about that. And secondly, is what I said earlier, which is it really is, I think, and I think, Purnima, you'd agree with me that we take the responsibility quite seriously in terms of disseminating the findings and what we learn to all parts of the country, because it isn't just kids in Ontario who are facing this. My office works coast to coast. I can absolutely categorically tell you that this is a challenge faced pretty much by every community across the country. So I hope that answers the question.
Thank you. And if it doesn't, if the poster could elaborate in the question box, that'd be great. Are you aware of similar initiatives across the country? And in particular, this question was from someone in BC.
Similar around pathways. For this age group, I'm not. I know BC is doing some very good work. The last time I spoke with some folks in the government on the West Coast, there was some really good work that was starting to happen, and I don't know where they are. But it specific to 0 to 6, I'm not aware of anything like this going on in the country. Purnima, I don't know if you're aware.
I'm not. And what I would say is, and I see the comment in the chat box as well, I think that, to your point earlier, Chaya, around mobilizing knowledge related to early and infant mental health, I think that, we do try. So our focus at the center in particular is on Ontario, but we do see application more broadly. And one of the things we've tried to do is make sure that we are at national conferences and also international conferences. And so pre-COVID, we had planned on being at a session in the States, the Tampa conference on evidence-based service delivery in children and youth in particular. So that's a very specific kind of conference, and yet it draws an international audience. And so the hope was to try and share this more broadly so that we can not only share what we're doing, but also learn about what's happening in other jurisdictions, because they may have solved this problem already. And it could be a plug and play sort of thing that we could use as a solution. My hunch is that that's not the case, but there may be elements for us to draw on from good work that's happening across the world.
Wonderful. Thank you. The next question comes from someone from a treatment center, children's treatment center in Ontario, and wondering what the knowledge sharing opportunities have been for you to share this information with CTCs across Ontario to support children's mental health.
So that's a great question. Maybe I'll take this, Chaya, and I'll flip to you to elaborate. Again, we are in the process we've done a lot of mobilization of the policy paper. So we do present at Children's Mental Health Ontario. We actually presented twice at Children's Mental Health Ontario. First, when the work was getting going, because we saw it as an opportunity to engage with provincially all of the service delivery organizations. And CMHO tends to be the one conference for folks who aren't aware. It's the Children's Mental Health Ontario conference, and it brings together all of the different member agencies, and there are hundreds of them throughout the province, to a conference every year. And so that was an opportunity for us to tap into the experiences of people across the sector. And then the following year, we actually presented on the topic, on the policy paper. Chaya and our team at the center presented just recently. And so that's a way of kind of showing the continuity of the work, or the evolution of the work, from sort of idea to policy paper and now to implementation. I think that as we get more and more information and learn more about the process as it's unfolding within communities, I think what we'd like to be able to do is mobilize this knowledge more broadly, again, obviously at a conference like Children's Mental Health Ontario, but other mental health conferences as well, both nationally and internationally. The other thing, and certainly this is on many of our radars, is the idea of publishing this work somewhere. We want to make sure we get it out and share it, because it is really, when we talk to different players across, my experience also speaking internationally with folks, is that people are very, very excited by the idea, because it's certainly something that is on many people's radars. And again, they don't know exactly how to identify these things, and then they don't know how to engage with partners across a community in order to provide that holistic response to a family. So I would say, we'll certainly welcome different kinds of mobilization, suggestions for different kind of mobilization activities. This is a really good example of one where, Paula and her team had connected with us and asked us if we could share this information, knowing that it's not exactly the center stakeholder group, nor is it infant mental health stakeholder group, but certainly a more broad collection of folks who do work with children in the early years.
Thank you. The next question is, how did you identify and entice the community stakeholders to come to the table?
So maybe, Pranima, if I can start to answer that, and then I'll bounce it back to you. So first of all, both organizations have pretty strong networks into communities across the province. And so we really went back to those communities where we knew we had champions. We knew there were people who were as passionate as us. And some of the responsibility was actually put on them. They share our passion. They want things to be better for these little kids. So we basically worked with them and supported them in reaching out to, boards of education, public health leaders, et cetera. And it was really quite amazing who came out. And in all of the communities, both the center and my office, AMP, had already been doing work. So we weren't new to these communities. We may have been new to some of the sectors, but because of the existing relationships, it was easier for the people we knew to sort of, really give a sense of the relevance and the meaningfulness of this work and why their voice at the table was so critical and so important. So I think leveraging our community champions was probably the most important step that we took. So the credit to getting people to come, it doesn't belong with us. It actually belongs with those champions at the community level. So Praneema, I don't know if you have something else to add to that.
I think that's a great summary, Chaya.
Yeah. Thank you. We have had a comment that in Nova Scotia has been working on the pyramid model for the last year that sounds a lot like what is being worked on there. I've asked this poster for a bit more information in the chat box about the model if she has it. We'll wait and see if any more comments come. Are you familiar with the pyramid model?
I am familiar, it's Chaya speaking, and I am familiar with the pyramid model, but it is very focused on the early learning and care sector. So there are some folks in Toronto who are looking at that. Our office has chosen quite deliberately to take a much broader approach and that was why we actually developed the competency framework, because it really did need to look at promotion, prevention, early intervention, and treatment, very specific to mental health for 0 to 6. So I know the work that happens through the Pyramid Initiative is excellent. I think that it certainly ties in well with the work that we're doing. It's not at all, in a completely different field. But I think the approach that we're taking is a much broader approach that is engaging a broader group of practitioners and sectors.
Thank you. Another question is, where can RECEs, and I'm assuming that's registered early childcare educators, but I could be wrong about the acronym, gain more knowledge about children's mental health and how to increase their knowledge and education?
So one thing that people can do right away is if they go to the IMP website, which is imhpromotion.ca, we've actually posted a free full-day webinar. You can stop and start it, so you don't have to watch it all in one go, on what we call infant mental health basics. So that is a really good starting place, and it'll really give you a good sense of what we're talking about when we talk about infant and early mental health, as well as the science behind it. We also run a webinar series that the Center of Excellence has actually been very supportive of, both financially and in terms of just promoting it. And we have guest speakers come every 2 weeks. We just had Dr. Gilles Julien present from Quebec on his model of early intervention and treatment for 0 to 6 and around mental health. We have had Charlie Zena, who is the editor of the Infant Mental Health Handbook. So this series really highlights practitioners, researchers, clinicians who are in the thick of this work and are generally just have accomplished amazing things. So you can sign up for that webinar series as well. There is a fee for that, unless you are a Children's Mental Health Center and a member of either CMHO or the Center of Excellence, in which case you would have free access to it.
What would your top 3 takeaways or next points of action be for folks in the audience who don't have access to a resource like this? Perhaps they're outside of Ontario.
So Chaya, is the materials that Chaya has just described are available on the website, so anybody can access them, including the free training webinar. The other materials are all available at cost, but I think that they are available broadly, correct, Chaya?
Absolutely. And our website has a lot of information that you can access from anywhere in the world that is free. So while there is a fee for the webinar series, there's a lot of other stuff on our website that you don't have to worry about paying for, that people can access.
Great, thank you. That brings us to the end of the questions posted. I'm going to give folks another couple of moments to add any last questions into the question box. And in the meantime, is there anything either of you, Purnima or Chaya, would like to say in summary?
Well, I'll just start by saying thank you to those of you who attended, and it's always exciting for us that when people are interested in early mental health, because it so often isn't part of the mental health discussion. We're an unfunded program at the Hospital for Sick Kids, so this really is, it's not new in Canada, but it's new in terms of being part of the conversation. But we are still really working so hard to raise awareness. So thank you for attending today and for taking an interest, in our littlest kids. So thank you very much.
I would just echo what Chaya has said around, thanks to to Children's Healthcare Canada for inviting us to share this work. Thanks to all of you for your great questions and for your interest. I know that it's a really, really busy time for everyone. And so, the interest has been really, really, we're very grateful for it. I think that, for me personally, we went down the road of starting to focus specifically on early years mental health several years ago, where we did our first policy paper. And Chaya was also an author on that paper. It was led by Dr. Jean Clinton, who is pretty well known in terms of her work to promote early mental health. So that paper for us was very much let's get this topic on the radar of everyone, so that people understand how important it is to invest in the early years, because if you do invest in the early years, you save a lot of money over time as a system, and you also save a lot of heartache. So a lot of pain and suffering that families are experiencing when their little ones are struggling, much of that can be resolved when you can identify early and respond early with appropriate care. So that was a really great sensitizing sort of paper that we had launched. And again, that's on our website as well. But this most recent policy paper on the work that's evolved in collaboration with Infant Mental Health Promotion, I think has really brought all of this to life. And now we feel like not only have we raised awareness, but now we're actually helping communities to make changes that are really going to, at the end of the day, save, again, a lot of heartache, but also a lot of, financial investment later on in supporting mental health over the life course. And so I just think it's been a wonderful privilege for me to be involved with Chaya and other colleagues who are working in this area, and to help enable some of this work to happen locally across different communities in the province.
And we're very happy to help you spread that word as well. There was one last comment, and it related back to the Nova Scotia Pyramid Framework. It's a framework, the poster shares, it's a framework of evidence-based practices for promoting young children's healthy social and emotional development. It focuses more on how ECEs can support young children's mental health on a day-to-day basis. And that is, one more question is there any way to get the simple gift videos free or online for families?
Oh, you can get it free. Just send me an email and we'll get it out to you.
I will
And I would say that to anybody, if there's anybody who wants a DVD copy of the simple gifts, we have a number of copies sitting at the office. And given technology today, we're just finding that, this is not necessarily the best way. So I think you could get the DVD and even just copy it onto your tablet or your laptop, whatever. So for anybody who is looking for the Simple Gift series, just email me and I can definitely make sure a copy gets sent out to you.
Thank you, Chaya and Purnima, for sharing your innovative partnership working to improve the mental health of 3 to 6-year-olds. It's quite fitting that you shared this important information with us this week, as tomorrow, May 7th, is National Child and Youth Mental Health Day. It's hosted by Family Smart since 2007. The theme this year is caring, how you show caring and what makes you feel cared for. Participate in the discussion on Twitter using hashtags #ICare or Child and Youth Mental Health Day. Stay tuned throughout the day to the Child Health Can Twitter account for caring messages from child and youth mental health leaders from across the country. Thank you as well to our audience joining us live and listening in on the recording. Typically, Children's Healthcare Canada hosts our Spark Live webinars every Wednesday at 11 a.m. Eastern. However, during this COVID pandemic, we are also offering special editions of some of our knowledge sharing opportunities. These may fall outside our typical webinar time slots. To stay up to date on all of our activities and events, please sign up for the Children's Healthcare Canada Spark newsletter if you haven't already done so. It's always great if you watch live, as your questions and comments really enrich the discussion, but if you can't watch live, the recordings to these sessions are made available after the fact on our Knowledge Exchange network. Next week, we're pleased to bring you 2 webinars. On Wednesday, May 13th, we have a webinar primarily for early career investigators in family, child, and youth health. It's conducting health research during COVID, challenges and solutions for leadership and productivity, and we'll be bringing that one to you in partnership with CIHR. And on Thursday, May 14th, we will be joined by colleagues from Sunny Hill Health Centre for Children, Sick Kids, and McMaster Children's Hospital for supporting families of children with medical complexity during COVID-19. So thanks again for joining us today. Thanks to Children's Healthcare Canada members and partners for supporting our webinar program, and hopefully we'll see many of you back here next week. Bye-bye, everyone.